Good afternoon. It's good to visit Bangkok Hospital and do this training on social science research. I'm a social scientist by profession, and of course I work with ethics committees. And one of the things that I train people in ethics committee to do is how to review social science research. Many times, social scientists hesitate to submit to ethics committees because they say that ethics committees is dominated by medical doctors. No? And usually, social scientists would complain that doctors medicalize the social science protocols. So that's their complaint. And it's not only social scientists who are complaining, people in the health sciences who's doing community research, community pharmacy, community dentistry, they say if we submit to our research ethics committees, they will start to ask for sample size. They will start to look at statistics. And sometimes we are doing research on behavior, but they want us to do an MRI, you know. These are complaints that I have received from people doing social science research. So the objective of my two presentations this afternoon is to make you familiar with some of the methods that are commonly used in social science research. Dr. Jaria, I think, has asked me to talk about how to prepare a good questionnaire. And a good questionnaire oftentimes is not only used in behavioral research, but it's also very much used in biomedical research. So first I talk about the use of questionnaire in research. And here I will talk about the examples. I will talk about the types of questions. What are the characteristics of good questionnaires? And then how do you design a questionnaire? So first I talk about questionnaire because usually questionnaire is the most common type of tool that is used in the social sciences in order to gather your data. So it does not use laboratory research, it does not use the clinical trial method, but usually you have to prepare a questionnaire so that you are able to explore your hypothesis, you are able to explore the research question. So questionnaire is very important. I think the most common type of questionnaire you will see in a hospital setting is quality of life studies, you know. When they want to do clinical trials about cancer patients, they would also like to do quality of life studies. And quality of life studies would make use of questionnaires. And many of them are standardized, so they ask questions in order to find out what is the perception of the patient about his quality of life. Quality of life studies essentially are subjective in nature, meaning it is about the patient perception of his quality of life. It is not about the opinion of a medical doctor about a patient's quality of life. It is about the behavior, the perception of a patient, whether he is able to cope with the disease, whether he is able to cope with the side effects of the medicine. You know? So these are questions commonly asked in quality of life questionnaires. You know? So those are common examples that you will see. Or you would like to do a survey of knowledge, attitude, and practice about clinical trials. That's also would make use of a questionnaire. Okay, so a questionnaire is a research instrument consisting of a series of questions for the purpose of gathering information from the respondents. So you are an investigator, You use the questionnaire as your data gathering tool. You prepare a list of questions, and then you tabulate the answers to these questions so that you are able to achieve the research objectives of your protocol. Questionnaires can be effective means of measuring the behavior, the attitudes, the preferences, the opinions and intentions of relatively large number of subjects more cheaply and quickly than other methods. Meaning, if you have a questionnaire that you will administer to 100 persons, you don't need to prepare your questions differently for the 100 persons. You just do one, and all the things that you want to ask are there, so that saves you the time to be able to do your study. So, what are the types of questions that you ask? Essentially, there are two types of questions. You have the close-ended questions, and you have the open-ended questions. You have to decide what kind of questions are you going to ask. Let's talk about close-ended questions first. Here, you structure the answer by only allowing responses which fit into pre-decided category. So, you ask your question, do you want to live in Thailand? So you say yes or no. That is a close-ended question. Are you a foreigner in Thailand? You answer yes or no. Okay? That's close-ended. You have no other choice. You say yes or no. Then you say, what's your sex? Male, female. Of course, now, there are many other forms. Now they have to include so many other things. Are you transgender? Are you LGBTQI? Depending on the research question you would like to ask. So, but here you have predetermined choices. You will check one. So that is an example of a close-ended question. Or so. You may be restricted to two options, yes or no, or it can have several options. Gender. Before, you only say male, female, but now you have to say what? Lesbian, gay, bisexual, transgender. It has become longer, QI, So, what is the type of gender that you need to know in your protocol? It will depend on your protocol. What are the types of gender that you need to identify in your protocol? Or it can be ordinal data, which means you rank it. This often involves using a continuous rating scale to measure the strength of attitudes of emotion. For example, you say, this medicine is good for my stomach ache. You make a statement like that. This medicine is good for my stomach ache. Then you make your participants choose the right answer. They say strongly agree, agree, neutral, disagree, strongly disagree. So this is a Likert scale. In social science, we call this the Likert scale, where you try to measure how strongly they feel about it. For example, another example, there was a study about bullying among children. And they want to determine the behavior of a bully. So one of the statements they make is, do you quarrel with your classmates? Then the child will answer, all the time, many times, a few times, never. They have a choice, okay? That still is a close-ended question. Then they will also ask, do you miss class? In other words, are you absent from class? Then the child will answer, all the time, many times, a few times, never. Okay? So that's an example of a close-ended question. You make a statement and then they're going to express their feelings about it, their attitude about it, or their practice about it. So it can be as easy as a yes or no question, or you can make statements and you find out what is their reaction to a specific question. That is also an example of a close-ended question. So they can be dichotomous, meaning you only have two options. You say yes or no to choose from. It is the easiest form of questionnaire for the respondent in terms of answering it. But many times, yes or no is not sufficient. Sometimes they want to say, not applicable. Not applicable. So that's the limitation of a yes or no question. So you say, are you male? Then you make them answer yes or no. It's not appropriate because it may not capture their gender preference, you see? So that is a limitation. If you only say yes or no, then you are not able to capture the other forms of gender preferences. So you choose yes or no when it is appropriate. But if there are other types of answers and it cannot be answered by yes or no, then a dichotomous question may not be the best type of question. So you are looking at the appropriateness of the questions you are asking. Or it can be multiple choice questions, just like your pre-test. There are multiple choices and you choose the best answer. You give them many options, but then they're supposed to choose the best answer. So that's multiple choice. Respondents are offered a set of answers they have to choose from. The downside of questionnaire with multiple choice question is that if there are too many answers to choose from, it makes the questionnaire confusing and boring and discourages the respondent to answer the questionnaire. Again, it talks about being able to use the appropriate type of questions to be able to get good responses. Or it can be a scaling question. You rank. What is most important to you? You can ask that question. What is most important to you? Then you say, you rank it. You say, your country, your profession, your family, your religion. Then you ask them, rank. What's number 1 for you? What's number 2 for you? Number 3 and number 4. That's also a close-ended question. You ask them to rank, and therefore they will see what is most important to the respondent. So ranking is another type of question. So that's close-ended. In other words, you present them with the options and they're supposed to choose one answer. Close-ended questions are quite difficult, because you have to think of all the possibilities and you have to write them down. In other words, you must have a very good idea of what answers your participants will think about, because you limit them to the type of answers that you have enumerated there. So usually, this type of questions are more difficult to prepare. Close-ended questions are more difficult to prepare because you have to think of all possibilities. It's just like giving an exam to students, If it is objective type of exam, then you have to write down many things. If it's multiple choice, you have to write down all the possibilities, So it's very difficult to prepare. But what is the advantage of close-ended question? It's easier to process. So if I give you a multiple choice exam, and then later on I will say the right answer for number 1 is A, for number 2 it's D, for number 3 it's C, it's very easy to correct. The same is true in questionnaire. If it's close-ended, they're easier to process but harder to prepare. As different from open-ended questions. Open-ended question is like essay test. No? So you ask their opinion. Is it ethical for the investigator to do this? Then they will give all kinds of answers. No? It's easier to prepare because all you need to do is write down general questions, but very difficult to process. No? So teachers usually would rather take time to prepare close-ended questions in an exam so that it's easier for them to check. But sometimes, especially if you're teaching in the graduate school, it does not really capture the thought process of your students, and therefore it's good to ask essay questions. And in essay questions, these are open questions. You say why, you say how, you say, you ask all these questions that will enable the students to analyze. They're easier to prepare, but very difficult to process. Me, for example, when I'm checking essay tests, I have an idea of key points, key ideas that I want to appear in the answer. But I cannot say it's either yes or no. What are the key ideas that appear there? You're able to explore that in open-ended questions. So they differ from other types of questions in a way that it may produce unexpected results. If I ask a student, an essay question, I don't know how he will answer it. And sometimes they may even come up with things that I did not discuss with them, which may be very valid. And that is the advantage of open-ended questions. You don't put limit on the type of answers that your participant will give you, but you are able to explore the consciousness of your participant. Because sometimes you really do not know how they think. You really do not know how they interpret certain things. And open-ended questions will enable you, will give them the opportunity to be able to express what they think, how they feel, So that's the advantage of open-ended question. So it can make the research more original and valuable because the answers did not only come from you, but it may be difficult to analyze the results of the findings and is generally used in qualitative research, where the direction of the analysis is determined by the respondent. Later on, I will talk about qualitative and quantitative research. Quantitative, will enable you to measure the responses of your participants. So you say, strongly agree, you give that 4 points. Agree, you give it 3 points. Disagree, 2 points. Completely disagree, 1 point. Then neutral is 0. You're able to assign points. So it's very easy to process. You are using statistical tools. You are using numbers to be able to analyze the results of your study. So in statistics, you need numbers. And close-ended questions will enable you to measure the types of responses that has been given to you. As different from qualitative research, because in qualitative research, you have no preconceived idea. You let your participants answer the question in any manner you want. And chances are, the investigator's perception of the problem is going to be different from the participant's perception of the question. So it has its advantages and disadvantages, but in qualitative research, we usually make use of open questions, and they are very difficult to measure. So, what are the qualities of a good questionnaire? So first, you must use the appropriate type of question. Sometimes you can combine both. So you have close-ended questions in the beginning. Then at the end, you say, what suggestions do you have to improve care in the hospital? Then they can tell you many things. That's a combination of close-ended and open-ended. So if this is a questionnaire, you want to get feedback from your patients in the hospital, then you can ask them, are you happy with the services in the operating room? Then they can say yes, no, or they can say strongly agree, agree, no opinion, disagree, strongly disagree. Okay? And then later on, you can ask, at the end, you say, what suggestions do you have in order to improve the services in the operating room? Then that is an open-ended question. But you should know how to process them. So, a good questionnaire directly achieves the research objectives. It requires adequate preparation to probe all possible angles of the research question. That makes your questionnaire valid. So you have to link the questionnaire to the objectives of your study. And usually, the objectives of your study is made up of two parts. One is a general objective, and then you break down the general objective into specific objectives. The specific objectives should become the basis for the type of questions that you're going to ask. So you go one by one to your specific objectives. You know that objectives should be SMART. Okay? You learn that. What does SMART mean? S means what? What's S? Specific. Specific. All right? S means specific. So you say, to determine the quality of life of cancer patients. That's your general objective. Now you break it down into specific objectives. So you say, to determine the physical quality of life, meaning physically, how do they feel? Then you say, to determine the social quality of life, meaning interaction with other people. That's another specific objective. Then you say, to determine the emotional quality of life. Okay? That's another set of questions. Then you can say, to determine the professional quality of life of people with cancer. In other words, you break down quality of life into specific areas, and they are specific enough so you can measure them. And therefore, one set of questions will measure physical pain, physical discomfort, You'll ask them questions about physical discomfort, all right? The second set is about social life. Another set is about emotional life, psychological life. And then a third set maybe is about their professional life. Are you able to perform your profession, without being embarrassed? For example, I've seen a dermatology quality of life study. Dermatology, all right? So they first set, do you feel pain, from your psoriasis? Then all those types of questions about physical pain. And then psychological, are you embarrassed, by the indications of psoriasis in your skin? Then you explore all those questions. Are you able to practice your profession? In other words, the general objective is divided into specific objectives which will be the basis for the type of questions that you will ask. No? So the specific objectives, they're SMART, they're specific, what's M? They're measurable. What's A? What's A now? I forgot. A is attributable. No? And then R is realistic and T is time-bound. All right? Your specific objectives will become the basis for your questionnaire. So at the end, you will check this about physical, this about emotional, this about professional, this about social life. Did I cover all? Then you are able to prepare a comprehensive set of questions. So, it should be linked to the objectives. All right? It provides complete and accurate information. Respondents should fully understand the questions and not likely to refuse to answer, lie, or conceal their attitude. A good questionnaire is organized and worded to encourage respondents to provide accurate, unbiased, and complete information. So, how do you do this? How do you make sure that the way you think about your questions will also be the same way that your respondents will think about it? Usually, you do a pre-test. And you will see in the pre-test, you test maybe 5 of your target population. You see if they understood the questions. If they're asking you clarification, that means your questions are not clear. So pre-test will enable you to be able to see if they understood the question. So designed as to make sound analysis and interpretation possible. Make it easy for respondents to give the necessary information and for the interviewer to record the answer, and it should be arranged to enable sound analysis and interpretation. How do you administer a questionnaire? It can be a self-administered questionnaire, meaning you distribute it, just like the exam, it was distributed to you and you answer it in any manner you want. Or it can be through interview. Someone is asking the question and then the participant will answer. Usually, if there is someone who is administering the questionnaire, it enables, it gives the investigator a chance to make clarifications. But if it's self-administered, there's no chance that clarifications can be made. It should be brief and to the point, and so arranged that the respondents remain interested throughout the interview. So, these are qualities of a good questionnaire. All right, I would like to look at this diagram. All right? So, here, what is your research problem? What is your research problem about? And usually, it's good to prepare a conceptual framework. Conceptual framework will define the different concepts or ideas that you are using. This is particularly true if you are doing a master's thesis or a PhD dissertation. They will ask you to define and to draw the concepts. For example, quality of life, you want to study the quality of life of a psoriasis patient. Okay? So, you will draw, this is the patient. What is the range of his experiences? So you say, physiological, psychological, emotional, social. All right? You divide his perception into these types. And then psoriasis comes in. Then, how will it affect that individual? So, you want to explore his experiences now that he has psoriasis. his physiological experiences, his psychological experiences, his social, his emotional experiences, and then the outcome is his quality of life. You have to draw that. No? That is your research problem. If you draw it, no, and you can imagine it, it's easier to know what are the types of questions you will ask. So preparing a questionnaire is not doing it at random, no? That whatever you think about, you write. No? Yes, you may start that way, but later on, there has to be order and there has to be classification so that the sets of questions will answer your research problem. So, you start with problem definition, no? And to be able to define your problem, you search for secondary data relevant to your research problem. If this is about marketing or whatever, that is your research problem. This is what you refer to as literature review. You must do literature review in order to find out what are the dimensions related to the research problem. And here we're talking of quality of life of a psoriasis patient. No? But that's not enough. From literature review, you also do exploratory review with those knowledgeable about the problem itself or matters directly related to it. And you look at the personal experiences and that of colleagues. So maybe, usually, how do we do this? For example, I give you an example. We were doing a study about perception of clinical trials by cancer patients. We want to know what is the knowledge, the attitude, and the practice of cancer patients related to clinical trials. This is a study that we did in the Philippines. So, before we even prepared the questionnaire, I had one set of focus group discussion. Focus group discussion is a small group discussion from 10 to 15 people of clinicians and researchers. Clinicians who are doing clinical trials. So we asked them the questions. Why do people join clinical trials in cancer? And they gave us all kinds of answers. Who is the easiest to recruit? Who is the most difficult to recruit? Why do they stay in the trial? We're looking at the perception of the clinician, who usually are the investigators in clinical trials. That's one set. Then we did a focus group discussion of patients who are enrolled in clinical trial. And we asked them the question, why do you join clinical trials? Do you like to join them or you do not like to join them? Do you think you are going to get well if you join clinical trials? What are the risks of participation in joining an experimental study where there is no guarantee that the drug is going to cure you? We ask questions like that. What is the benefit if you participate in a clinical trial about cancer? So we ask the cancer patients about that. So that is the focus group discussion. Take note, I have no questionnaire yet. I have no questionnaire yet. We are only exploring, their experiences. And based on the focus group discussion results, then the next point is to write the specific objectives of the research, and then the hypothesis that we wanted to test, and then the last point was the development of the questionnaire. So it's a tedious process if you want to do a good questionnaire. It's not just asking things that comes to your mind. You have to ask the opinion, the perception of people who are familiar with this kind of study, and then put them together so that the questions you ask will be able to meet the objectives of your study. Take note, in focus group discussion, we are only using a guide, an interview guide. We have no specific questions yet. So focus group discussion is a form of qualitative questionnaire, qualitative study, so that we are able to learn from those who are in the practice, of clinical trials and those who have participated in clinical trials. So that part of the study is exploratory. We explore, what are the different kinds of experiences so that when we prepare the comprehensive and full-scale questionnaire later on, then it is complete. It takes into consideration what we learned from literature. It takes into consideration the answers that we got when we did the focus group discussion. Usually, you are required to do this if you are interested in an academic degree, your master's thesis or your PhD dissertation. Maybe if it is just a simple protocol that you want to do fast, you may not have the time. But I think very important is that there must be some literature review to find out what has been asked. And if you do literature review, you will encounter some standardized questionnaires that are already available. And you will decide whether you want to use them, you want to adapt them, what do you want to do with them? Or do you want to start a completely new set of questions? That is your decision. That is left at the discretion of the investigator. All right, so the design of the questionnaire will depend on whether the researcher wishes to collect exploratory information, focus group discussion. Focus group discussion can never be generalizable. The results cannot be generalizable because you're only interviewing a small group. At the most, it is exploratory. It cannot be the basis of generalizable conclusion. Or do you want some quantitative information? Then that comes at the latter end of the process. So, exploratory questionnaire usually is open-ended, used when the data to be collected is qualitative or is not to be statistically evaluated, and no formal questionnaire is needed. At the most, in a focus group discussion, we only have an interview guide. We list down several open-ended questions, and then they will answer in any manner that they want. So, prepare a brief guide, list 10 major open-ended questions with appropriate probe, meaning you probe. She will say, I do not want to participate in clinical trial. If you're asking them, do you want to participate in clinical trials? Then someone will answer, I don't want to participate in clinical trials. Then you ask, why? When we had this study, I asked them, who of you, I said, will participate in a clinical trial when you know that it is experimental and there is no assurance that you will get well? We asked them that question. And one lady said, I will participate. Okay? And I asked her, why? Why will you study? She said, even if I do not get well, I am willing to make a contribution to science, she said. And they can use my data so that science will improve. That's her answer. Then I said, who does not like to participate in a clinical trial? They all are cancer patients. Then one lady raised her hand. She said, me, I do not like to participate. And then I asked, why? She said, because I have young children and I do not want to participate in any research that will not give me a guarantee to get well. It might worsen my disease, she said. And then she points to the lady, the first one. She points to the older lady. The first one who answered was an older lady. She points to her and said, she is old. She does not have young children like me, you know. Then we take note of all those answers, you see. So you should be able to follow up your open-ended questions and you ask them the reasons for their answer. So a formal questionnaire may restrict the discussion and prevent a full exploration of the women's views and processes, in my example. So these are exploratory questions. It's just an interview guide that we use for exploratory research. Now, there are also formal standardized questionnaire. When you search the web, you will find standardized questionnaires that have been pre-tested and validated. They will tell you that. Meaning it has been used, and sometimes they will try to get a patent for their standardized questionnaire. In quality of life, there are many standardized questionnaires. So, they are used to test and quantify the hypothesis, and the data is to be analyzed statistically. Such questionnaires are characterized by prescribed wording. You cannot change standardized questionnaire. It's already standardized. If you change it, it might lose its validity and its reliability. That's the problem. Sometimes I sit down with many ethics committees. Then they will say, why are you asking this question? But it's standardized questionnaire. You cannot change. You can only do cultural adaptation. But you cannot change the text of standardized questionnaire. You will only pre-test. If this was done in Europe, you will pre-test if the Thais, your translation, is understood by your Thai respondents. But you will not change it. So please take note, when investigators are using standardized questionnaire, there's little room for changes because it might affect the validity and reliability of the standardized questionnaire. What you should ask for is cultural validation. Whether the questions that they are asking would correspond to the experiences of the Thai people, and whether the Thai people will understand such types of questions. Is it within their experience? We refer to that as cultural validation. But in essence, you have to keep the essence of the standardized questionnaire. So there's prescribed wording and order of questions to ensure that each respondent receive the same stimuli, prescribed definitions or explanation for each question. That one you may have to modify because of different Thai experience to ensure interviewers handle questions consistently and can answer respondents' requests for clarification. Because it has been used and it has been validated. That's the standardized questionnaire. A formal standardized questionnaire is generally characterized by prescribed response format to enable rapid completion of the questionnaire during the interviewing process. And usually, it makes use of close-ended questions. And it has been used before, and it has been validated. That standardized questionnaire. All right. Steps in questionnaire development. Decide the information required. And here, to decide on the information required, you have to look at your specific objectives, the specific objectives of your protocol. Define the target respondents. If this is about quality of life, about psoriasis, who are your target respondents? Is it the doctor or is it the patient? Quality of life is usually about the patient, not interviewing the doctors. quality of life is subjective. You know, some people may be poor, but they are happy. You see? So, that's their subjective thoughts. They are happy. Some people may be sick, but they are happy. That's subjective. It does not depend on how serious the disease is. Some may feel the pain, but they have high pain threshold and can endure the pain. So not everyone will have the same experiences. So who are your target respondents? Quality of life is usually about patient perception. I've seen quality of life studies reviewed by ethics committees, and ethics committee will say, why don't you ask the doctor? Why? Because quality of life is about the patient, not about the doctor. You see? So you should understand who is the target respondents. Is it about the doctor or is it about the patient? Last month, I was attending an ethics committee meeting, and they wanted to see whether the residents know how to handle LGBT patients. Okay? So what's the research question? Do residents know how to deal with LGBT patients? And my question was, why are you asking the residents? Maybe you should ask the LGBT patients to find out whether they are handled appropriately or not, rather than asking the resident. So, are you targeting the correct respondents? You may target the residents, but the questions are going to be different if you want feedback on how clinicians handle members of the LGBT community. So identifying the target respondent is very important. Is it about the child or is it about the caregiver of the child? Who is your target respondent? You cannot get confused here. Choose the methods of reaching your target respondents. That's very important. I give you another example. There was a study about practices of teenage mothers. All right? Practices of teenage mothers, meaning how they raise their children. Now, what is the method that's being used in this study? They said they will do a household survey. How will you do a household survey? You will knock at the door of the house, and then you ask, is there a household mother living in this house? Will you get your respondents? Will they tell you, yes, they do not know you. You just knock at the door, and you ask, is there a teenage mother living in this house? Because I have a study about teenage mothers. Will they tell you? Maybe you will not be able to get, and they will say, none. So you're wasting so much time knocking at doors and asking the households, is there a teenage mother here? Because your target respondent is a teenage mother. So, is household survey in a community a good method to be able to interview teenage mothers? May not be a good method. So if you want to interview teenage mothers, where should you go? Oh, you tell me now. I think there are nurses here. Where? Where will you go? Do you knock at every door? Where will you go if you want to interview teenage mothers? Where? Huh? Where? Go to the labor room. Maybe not labor, maybe after, in the ward. Okay? Maybe you go to the ward, where they stay after delivery. Because if you go to the labor room, it's very difficult to interview them when they're having labor. They might tell you, go away.
We check the name and then we go after arrested, maybe after the
So you just check who. But can you recruit them? Can you recruit them?
then we go to OPD.
Then they might ask, how did you know I'm a teenage mother? There's an issue of vulnerability. How should they be recruited? Who should recruit them? Who? The nurse. If you are in the labor room, then it is another person who's doing the study. Then they can ask you, because you see them, all right? You're a caregiver. Then maybe if I'm a social scientist, they don't want me to be asking them, are you a teenage mother? Because I'm alien to the hospital scene. But if these are the nurses, then maybe the nurses should be the one to recruit and ask, there is a study about teenage mother. Do you agree to be interviewed? If she says yes, that teenage mother is referred to me because I'm outside of, the hospital and the healthcare. Okay? So recruitment is an issue in this type of research. So, how do you choose the method reaching your target respondents? In Thailand, there are many studies about men having sex with men, Where do you go? They say, we will go to the bars at night. What? You will ask them, do you practice sex with other men? How will you recruit? How will you recruit? See? You just cannot ask them. They will feel offended, And they will say, no, They don't like to answer your question, all right? So how will you recruit? In many of the protocols I've seen in Thailand, they use peer recruitment. Peer, someone who's a member of the MSM community will be the one to recruit. Do I need to interview them myself? I will ask them, what are your practices? How do you protect yourself from HIV? Can I ask that? Sometimes they will not give you the answers, truthful answers, because you are a stranger to them. So that usually in these types of studies where there is stigma, it's better to train peer interviewers. Peer, meaning they belong to the same community of MSM, they know each other, you train them to be able to administer your questionnaire so that you are able to get truthful answers. That's very important in social research. Choose the method of reaching your target respondents. And usually they will say, the method of recruitment will make use of the snowball method. What snowball? You recruit one. The one that you recruit will recruit another 2 or 3. Then, it multiplies until the snowball becomes bigger and you are able to get the number of respondents that you want for your study. And many times, it's not me. When I take the taxi in Bangkok, then they will ask me, where are you from? And then I say, Philippines. And then next question, they will say, are you a teacher? At once, maybe I look like a teacher, So if I'm a teacher and then I'm the one interviewing MSM, maybe they will not give me truthful answers. But it's better that there is a peer interviewer who will ask these questions. You don't need to know who they are, but you need the answers to their questions. And my job is to analyze the answers, as a researcher. So, decide on question content. I showed you how to look at the question content. Develop the question wording so that it's understood appropriately. Put questions into a meaningful order and format. No? First physiological. Then next set of questions is about psychological. Next set is about social. There's order to the questions rather than you jumble them all together. Check the length of the questionnaire. Pre-test the questionnaire and then develop the final survey form. So that's how you develop the questions. Very important steps. Decide the information required. What are the things one needs to know from the respondent in order to meet the objectives? Additional help can be obtained from literature review, previous rapid rural appraisals, and exploratory research. Further, a small number of preliminary informal interviews with target respondents may help clarify ideas about what information is required. I was explaining that earlier. Define the target respondents, define the population that will be the research respondents, decide the inclusion and exclusion criteria. MSM, this is only male. What age? So that should be in your inclusion criteria. Someone wanted to study the concept of being gay. And he said, I only want to study the elderly gays. So he said, inclusion criteria will only be 60 and above because the concept of elderly gays is different from the concept of gay by the millennials. And he wants to compare. So you have to set your inclusion and your exclusion criteria. Draw up a sampling frame. Take into account factors such as age, education of the target respondents, demographic information. What's demographic information? You will ask them, what's your age? Okay? What is the highest level of schooling? That's demographic information. What is your religion? Which area do you come from? That's demographic information. Are you married or are you single? Sometimes, ethics committees, if they don't understand the questionnaire, they want to delete all the demographic information. They say, why do you want to know where they come from? Why do you want to know their religion? It has nothing to do with your study. But take note, in social research, you can draw relationships using your demographic data. Male and female, you can contrast them. You put together all males and you find out what's the response. I give you an example, smoking, all right? This is a study about smoking. You can compare the reasons for smoking among men and you will find out that the reasons of women are different. So you can stratify them. Smoking, you divide them into age groups. Why do old people smoke? Their reasons are going to be different from the reasons of people who are young. That's coming from your demographic data. So you can compare educational level, reasons for smoking. It can be different from each other. So you can group those with higher education in contrast with those who have lower education. So the data becomes very rich just using demographic information. So just do not, sometimes demographic information is very good source of data. Draw up a sampling frame. Take into account education, etc. of the target respondents. Choose the method of reaching your target respondents. Personal interview, focus group discussion, mail questionnaire, telephone interview. Which of these would have high response among this type? Do you have good response from mail questionnaire? Sometimes it's very poor, right? The return is very poor. So maybe you can what? Predict something like less than 50% will respond to your question. No? So that sometimes it's better to do personal interview. Ask for, an appointment so that you can interview them. It's more expensive, but it has better returns. No? So you have to decide how is going to be done. Each has its advantages and disadvantages. A general rule is that the more sensitive or personal information, the more personal the form of data collection should be. That's the rule related to the method that you're going to use. Decide on question content. Researchers must always be prepared to ask, is this question really needed? The temptation is to include questions without critically evaluating their contribution towards the achievement of the research objectives as they are specified in the research proposal. No question should be included unless the data gives rise directly to use in testing one or more of the hypotheses. But sometimes, in some questionnaires, one or two questions may be repeated. Why is it repeated? You want to know whether the next time you ask the question, the respondent will give the same answer. So, repeating a question sometimes is a test of consistency. Consistency of the response of the respondent. If they give different answers, that means, he is not convinced of the answer that he's giving. That's a test of consistency that sometimes social scientists make use of. Develop the question wording. Should it be open-ended? Should it be close-ended? Allow the respondent to answer in his own words with no influence by any specific alternative. That's open-ended question. Reveal the issues that are most important to the respondent and may reveal findings which were not originally anticipated. Respondents can qualify their answers or emphasize the strength of their opinion. This is about the advantages of open-ended questions. Some problems in open-ended questions. Respondents may find it difficult to articulate their responses, to properly and fully explain their attitude or motivation. That's why in open-ended, you have to follow up the question so that it makes it easier for them to give an answer. It allows for follow-up. Respondents may not give a full answer simply because they may forget to mention important points, and others need prompting or reminding of the type of answers they could give. Data collected is in the form of verbatim comments. This is open-ended question. That may be hard to code and reduce to manageable categories. If it's open-ended, you have to write down all the answers. Usually, I have a research assistant who will write down all the answers. And later on, I will go over it and say, these answers belong to the same idea. So first, there's a listing of all answers. And then me, as the investigator, I will check, I will group the answers into specific ideas. And the theme will emerge. What is the theme of the response? In open-ended questions, you are looking at themes that the respondents talk about. And you should know how to group them into themes. So that's the method in qualitative research. All right, respondents will tend to answer open question in different dimensions. So it requires an expert to to organize them into themes. An open response option is a form of question which is both open-ended and includes specific response options as well. Put questions in a meaningful order and format. The question flow. One leads easily and naturally to the next, and should be grouped together. So my suggestion earlier, all questions about physical comforts and discomfort should be grouped together. All social aspects should be grouped together. So in social, you say, does it affect your relationship with your family? Does it affect your relationship with your friends? Are you embarrassed by your psoriasis when you go out of the house? Those are classified as your social response to your psoriasis. So that's the grouping. Question variety. It usually improves response to vary the task from time to time. You can use cards, pictures that can help respondents understand, and it makes the pace easier. They don't get bored. You are not talking all the time. You have pictures. So that's a way of introducing variety. Check the length of the questionnaire. It is best that the questionnaire be as short as possible. A long questionnaire leads to a long interview, and this is open to dangers of boredom on the parts of the respondents, interruption by third parties, greater cost in terms of interviewing time and resources. Okay? So in rural situation, it says an interview should not last longer than 30 to 45 minutes. Pre-test. The questionnaire is to determine if the wording will achieve the desired results, if the questions are understood by all classes of respondents, if instructions to the interviewers are adequate. Usually, a small number of representative respondents are selected for the pretest. You can choose 5 and then find out if they have problems understanding the words of your questionnaire. That's the pretest. And then you modify it, making it more understandable so that you are able to develop your final questionnaire. Develop the final survey form. If the questionnaire has been subjected to a thorough pilot test, the final form will evolve. All that remains to be done is the mechanical processing of laying out. Even the laying out, it should, especially if it's self-administered. Even if you use an interviewer, it's easier to lay out in a user-friendly format. So that is very important. How to write good survey questions. Write questions that are simple and to the point. Use words with clear meaning. Limit the number of ranking options. Do not ask them to rank 20 items. Very difficult. Usually 5. They can rank that easily. In a multiple choice question, cover all options without overlapping. Avoid double-barreled question. What's double-barreled question? What's an example? Do you like your doctor? And do you like to participate if your doctor is the investigator? You're asking 2 questions. The response to the 2 questions might be different. Do you like your doctor? And do you want to participate in a clinical trial where your doctor is investigator? You have to separate them. So first you ask, do you like your doctor? Yes or no? Do you like to participate in a study where your doctor is investigator? Yes or no? All right? You cannot ask 2 questions at the same time because you don't know which part of the question they're answering. That's double-barreled question. Offer an out for questions that don't apply. You say sex, male, female, then maybe NA, not applicable. That's an opt-out. Avoid offering too few or too many options. Make recall easy. What are their experiences? That's why you have to do an exploratory study first, so that you know what's in their mind and you can capture them in the kind of questions that you're asking. All right. Now, scientific soundness is very important, and you assess the validity of questionnaires. Validity is an indication of how sound the research is. It applies to both the design and the methods of research. Validity in data collection means that the findings truly represent the phenomenon that is being measured. Valid claims are solid claims. Validity refers to the accuracy or correctness of the findings. All right. So, how do you ensure validity? There must be a link between the specific objectives of your study and the questions you are asking. As I said earlier, you just cannot randomly ask questions. You must look at the objectives of your study. Your questionnaire is your data gathering tool. And your data gathering tool must achieve the specific objectives of your study. That's why in ethics review, we always say, submit the questionnaire. Submit your data gathering tools, because we want to see whether your data gathering tools will meet the objectives of your study. It's not enough that you submit the protocol. There are many ethical issues and scientific issues related to your data gathering tool. Validity is a scientific measure. Is your data gathering tool valid to be able to achieve the specific objectives of your study, so that you are able to come up with good conclusions that makes the study valid? If there is no link between your objective and the methods, your study will not be valid. You are not measuring the research question properly. So that is the meaning of validity. Reliability, consistency with which the research will produce the same results. Reliability is directly related to the validity of the measure. Validity is more important than reliability. Reliability is consistency. Consistency, but valid is more important than consistency. There are two kinds of reliability. Internal reliability assesses the consistency of results across items within a test. And external reliability refers to the extent to which a measure varies from one use to another. So internal reliability, you will check, and you do this in the pretest, whether they will answer in the same manner, in the same consistent manner. And external reliability, you will compare the reliability of what you did with something that has been done before. A standardized questionnaire compared to a questionnaire that you just prepared. Is there external reliability? Are you able to come up with the same results? So it can be internal within the questionnaire itself, or it can be external. You compare it with other questionnaires, and usually these are standardized questionnaires. You compare your reliability with something that has already been standardized. That's external reliability. Okay, what are the ethical issues? Because it's about ethics. Ensure that the information provided by the respondent is kept confidential. How do you ensure that? All right. Questionnaires are good for researching sensitive topics, as respondents will be honest when they cannot be identified, and it will reduce the likelihood of any psychological harm, such as embarrassment. So how do you achieve that? you do not ask them to write their names on the questionnaire. That's a general rule. You don't ask them to write their names on the questionnaire. If you want to keep track of them, you assign a number. All right? This is respondent number 1. And then you keep a separate list. Respondent number 1 is this person. The name is there, but they are separate. You know, in Thailand, we were working with some biostatistician, and then he tells me, he said, you know, I was putting together the results of one study. Of course, the biostatistician has access to the questionnaire, all right? And in the questionnaire, they write the name. And this was about gay men. And he was telling me, he said, you know, I saw the questionnaires used for one study about gay men, and I found out that this actor is gay. And I said, how did you know? He said, because I saw his name, you know. He was answering a questionnaire about men having sex with men. So normally, you don't put the name. You anonymize the questionnaire, all right? But you can have a code, and that coded information should be kept under lock and key. So that's an ethical issue. Participants must provide informed consent prior to completing the questionnaire and must be aware that they have to withdraw their information at any time during the survey. All right, I'll give you an example. When we were doing perceptions of cancer patients about clinical trials, one of the questions we ask is, what did you do when you found out you had cancer? Then she stopped. She said, can we stop for a while? She was telling me, I was the one doing the interview. She said, can we stop for a while? You are making me recall things that I have already tried to forget. Because having cancer was a very bad experience for me. Now you are asking me, what did I do when I found out I had cancer? She wanted to cry. No? So I said, okay, we can stop. Then tell me when you are ready to resume. If at that point she said, I don't want to continue with this interview, you should allow her to withdraw from the study. That's very important. Okay? So do not say, but I gave you transport money to come here. You must complete this questionnaire. You know, you cannot say that. No? So participation is voluntary. And usually, if it is about sensitive information, if it is a topic that will cause emotional stress, like this one, we are making them recall their cancer experience. She was involved in a clinical trial. But when we asked her, we said, what did you do when you found out you had cancer? She already wanted to cry. So participation is always voluntary. At any point, they can withdraw. Did we have an informed consent for this study? Yes, we did have an informed consent. We said, we will ask you questions about your cancer experience. We will ask you questions about your clinical trial experience, and we will record all your answers. And she said, yes. No? She signed the consent form, but when we were asking the questions, you know, she wanted to withdraw. If she withdrew at that point, she should be allowed to withdraw. Okay, now let's talk about informed consent in social research. If this is about public behavior, let's say this is a public opinion survey, all right? About what? Your prime minister. Wanting to ask you if you will approve of your prime minister. First measure, you should not write the name. I told you that, all right? So you know, oh, this person does not like him, this person likes him. You should not be able to pinpoint who, you know? So it must be coded information if you want to check who this person is. Maybe later on you will say, I want to know their age group, I want to know the educational level, so you go back, who is this, okay? But not in the questionnaire, first measure, all right. Second measure, do you need informed consent? Signed informed consent? If I'm doing a public opinion survey, do I need a signed informed consent? Not necessarily so. Consent may be oral. Because you're not interested in saying, who is this person that does not like the Prime Minister? You're only interested in counting how many like the Prime Minister, how many does not like the Prime Minister. You're not interested in identifying who they are. And therefore, in such types of studies, it's not like medical record, that you will go back to the medical record and find out what is the disease, you know, who is this person, what happened to him, etc. Some types of retrospective study, you may want to know who this is. But if you are not interested in finding out who this person is, and you are only counting, consent may be oral. Also, if this is about stigmatizing behavior, you want to make a study about addiction, okay? Do you need consent? You will interview them about addiction. Yes, you need consent because this is stigmatizing behavior. But maybe oral consent may be better than written consent because the written consent will identify them. That's a possibility. But again, it is up to the ethics committee to make that decision. It may be oral, but in oral consent, the text has to be approved by the ethics committee. And you will read the text. You just cannot say anything you want to say. Oral consent means they do not sign, but you read the consent form to them. But there may be a waiver of signature. It is not waiver of consent, it is a waiver of signature. However, in very low-risk studies, like for example, you want a survey of how many people like the food in the cafeteria. This is public behavior. There's no stigma. So it says survey about cafeteria food. That's your title. Do you need a formal consent? No. You can waive the consent. If they answer it, that means they agree, they gave their consent. If they don't answer it, they refuse to give consent. Very simple. Okay? So in informed consent, you have to check many things. One, what is the topic about? Can you waive consent? Usually in public opinion surveys, you can waive consent. And public opinion surveys normally do not pass ethics review. That's in social science research. It's exempt because it is about public behavior. But when you start exploring private behavior is something that you want to keep in private. You do not want people to know about it, like sex. Or illegal behavior, that's private behavior. Then, waiver of consent may not be given. It can be oral, it can be written, but there is need for consent. So one classification, is this public behavior or is this private behavior? In surveys, in social research. Public behavior, when there is no stigma, no implication, no political implication, then you can waive consent. If they answer it, they have given their consent. If they don't answer it, then they refuse to give you consent. So that's consent form related to social research. It's not like biomedical interventions, where you do something to them. And therefore, it's very important that there is consent, there is assent, there is LAR, In many of these questions, in many of public, in many of social science research, it may not be necessary. So it depends on the type of questions that you are asking. Okay, so I think that's my last slide related to questionnaire. Are there any questions about questionnaire? Then I will discuss ethical issues in social research later on. Yes.
If I translate questionnaire from Canada to Thailand and I want to do cultural validation, what should I do?
You need cultural validation. How do you do cultural validation? No? One, you have to examine the things that are included there. Is it the same situation in Thailand? No? For example, there was one study about COPD drug. No? And the protocol was coming from Switzerland. In Switzerland, COPD, that's chronic obstructive pulmonary disorder, all right? In Switzerland, the people who treat COPD are GPs. Is it the same in Thailand? The same. That was what happened in the Philippines. They used the protocol that was being used in Switzerland and brought it to the Philippines. But they allowed GPs to do the study. There were many errors. So that's one. That's one issue. Then you look at the kind of questions that they are asking. Is it applicable? The standardized questionnaire, everything is there. But you look at the practice. Is this applicable? You can do an FGD, about this questionnaire. A group of experts, let's say this is about surgery. Then, you do a focus group discussion of surgeons, whether this is the practice in Thailand, whether it's appropriate to use this. So you may modify it. That's cultural validation. But you have to pre-test the outcome. You have to pre-test the outcome. So that's the kind of cultural validation. One, is it the practice in your country? Oftentimes, it's not like that. The bullying, you're familiar with bullying, children. There are many children bullies now, right? Who bully other children. There was a bullying questionnaire that was being used in the US, and then they did this in the Philippines. But the environment in the Philippines is very different from the environment of children in the US, And then, how do they do it? They say, self-administered questionnaire. Children who are 10 to 12 years old answering the questionnaire. It's not proper, right? So then they will ask questions. Do you quarrel with your classmates? Do you miss school? Then the answers, never. No, the answers are all the time, many times, sometimes, never. And then, who's administering the questionnaire? The teacher. I stand in front of you and I say, okay, you answer. Will you answer truthfully? No, you will not answer truthfully. So many things related to cultural validation. Who is asking the question? Who's administering the questionnaire? What's the content? So something like this, which you will adopt from another country, I think you need to do cultural validation. And these are ways of doing cultural validation.
If we check the question and we get two experts to check and they said, okay, then is it right then?
I would prefer that it's a group of practitioners. I would prefer a focus group discussion. Look at cultural validation rather than key informant interview. Because if I only ask one, that's KII, key informant interview. No? So I ask someone who's an expert and I will ask him, okay, you check, is this culturally valid? But that's only one opinion. I would prefer a focus group discussion where you convene a group of experts, 10 experts. Then you explore because they are going to have different perception. It's better, I think. So these are the things to consider related to this. Okay, any other question? I know the nurses are doing a lot of questionnaires. Huh?
We can have a break and then come back.
Okay, so we can have a break and then we will come back. If you have further questions, I can answer them and then we proceed with ethical challenges in social research. Okay. Example of a simple questionnaire. This is a multi-country study that we did in FERCAP. And the protocol was prepared by a PhD student from Konkan, no, not Konkan, Chiang Mai, all right? So it's a survey of what information research participants would like to know in informed consent forms in biomedical research. You please take note that here, we only put questionnaire number, no name, all right? And this is the consent form. It says, the questionnaire is part of a research that aims to understand your opinion about the extent of information that you would like to know when you are invited to participate in a research study. Since you have experience being a research participant, that's the inclusion criteria, it will be valuable to improve the informed consent documents to be used in future studies. It will take approximately 10 to 15 minutes to complete the questionnaire, pages 2 to 6. Answering this questionnaire is entirely voluntary and your identity will be anonymized. You are free to refuse to participate or to skip questions you are not comfortable with. Answering the questionnaire means that you agree for the research team to use the information you provided for analysis. Your answers will be used only for research purposes. Very simple informed consent form. So with that explanation, then if they answer the questionnaire, that means they are giving their consent. All right, then there's instruction for investigator. Before distributing the questionnaire, tick the box below to indicate the type of biomedical research in which the respondent is participating. Is it experimental or is it observational? Okay. Now, next one. Please fill out your general information, age, sex, education. That's the demographic, nationality, occupation, filling date, year, month, and the day. Okay. I cannot get here. Okay. All right. Continuation of the consent form. When you are invited to participate, you receive a document called Informed Consent Form. This document provides information to help you decide whether or not you will participate in the study. Below is a list of elements found in the informed consent form. Please indicate how important each of the element is. Very important means you really want to know about some specific information before you decide to participate. While not important means that you do not care to know about such information. Okay, so this is the questionnaire. You look, type of research. Do you want to know that? You tick, not important, slightly important, moderately important, fairly important, very important. Name of researchers. Not important, slightly important, moderate important, fairly important, and very important. Institutional affiliation of the researcher, and so on. No? So it's a very simple questionnaire where you just tick, and therefore it tells you that in 10 to 15 minutes, then you will be able to answer this questionnaire. This was published in an international journal. Usually, the journal will ask you, has this undergone ethics review? This protocol was reviewed in each country where we were doing it. And then they will ask you, did you get consent? Yes, we said we gave consent. No? So that's an example. Now, I also want to show you some open-ended question. This is not the one. Can you check the other one? It's in Word. That one, I think. All right. Can you full? All right. This is a tabulation, no, of the answers to the open-ended question. Question number 1. What measures should be adopted to improve research and its ethical governance in the Ministry of Health Hospitals? Then we list down everything there, you see? Next question, what do you think is the role of research ethics review? Then we list down the answers there. That's in open-ended questions. You list down all the responses. And then the second processing is what are the common themes, okay? Then you say how many said this, okay? So that more or less you are able to identify the different themes that emerge during this particular study. So it's quite difficult to process.
So how do you advise them? You said you choose whatever you think is appropriate, right?
No, the questions are general. What measures should be adopted to improve research and its ethical governance? No? Then one answer, administrative support. 2, continue capacity building. Invite journal publishers. You write down everything.
These are all the answers
Yes.
from the respondent.
Yes.
Open means no choice to choose from. Open.
Yes, it's open. Open-ended. Then you list down everything, and then later on, you group them. The investigators should group together what are similar answers. No? So that's how you analyze qualitative research. So, is it valid? No? That's the question. I think my next presentation will answer that. Is it reliable? All right. We look at reliability and validity of qualitative methods. So, I talk about ethical challenges in social science research. Maybe it's not about clinical, interventions. Most of them are only asking questions. But the conduct of social science research can be very challenging. Okay, so what is social research? It focuses on exploring, examining, and describing people and their environment, the socio-cultural, economic, and political context of complex health behavior. Here I'm talking about health social science that focuses on health. I'm not talking about political science. I'm not talking about economic surveys. I'm talking of health, about health social science. No? It deals with experiences of people in relation to health and illness. No? It's important to help improve our societies to become better informed, how societies should be put together. It seeks to understand the hows and whys of human behavior. You know, what's the importance of health social science research? Even if you discover the best drug and the best interventions for certain diseases, if the patients do not like to drink them, it is useless, okay? So you have to explore, why don't they like to drink certain medicine? Why don't they like to undergo certain interventions? No? That's human behavior. No? There are reasons. It may be cultural, it may be personal bias, but you want to know why. And that is what health social science research is all about. There are many ethical challenges in social research. No? It can be hypothesis testing or theory generation that requires appropriate design. Design is very important in social research. If you're interested in describing patterns of behavior, no, you need to do quantitative research, and that will yield generalizable information. But if you're only interested in going in depth into one case study, that is qualitative research. In social science, we only have two kinds of methods. It's either quantitative, that makes use of statistical tools for analysis, or qualitative. Qualitative is about in-depth insights, not generalizable. No? Or you can use mixed method. No? So it can be quantitative or qualitative. It depends on your research objective. If your research objective is to come up with generalizable conclusion, you need to use quantitative. But if you're not interested in generalizable conclusion and only want to go in depth, you can use qualitative research. Now, let me present to you one issue. In the Philippines, for example, the Ministry of Health outsourced a study about the effect of pesticide on the health of the community in a fruit farm. Okay? Effect of pesticide. Because they wanted to come up with a policy related to pesticide, what pesticide should be allowed, what pesticide should not be allowed. So, if this is the objective of the study, you need to use quantitative. You need to use quantitative methods so that the conclusion is generalizable. But this study was done only in one fruit farm, one. And then recommendations were made on what pesticide should be banned and what pesticide should be allowed. Now later on, industry complained that the results of the study are not valid because it did not use quantitative means and it only used the experience of one fruit farm. And later on, the policy had to be withdrawn. So what am I saying? The objective of the study should determine whether you use quantitative or qualitative. If the objective is health policy, it has to be quantitative. You have to look at many cases. It cannot be case study alone. But if you want to understand what happens in one fruit farm, this banana plantation, then you can use qualitative. So it's very important that the objective should match the type of method that you use, whether it is quantitative or qualitative. That is a scientific issue. That is an issue of validity. So that's one challenge, Many times, social scientists want generalizable information, but the method used is not appropriate. If I want to do a survey in Thailand, my earlier example, whether you support your prime minister or not, what kind of sampling should I use? No? Can I do quota sampling or convenience sampling and ask all of you to answer my questionnaire? Is that a valid method? No, no, because you are not representative of the population of Thailand. No? Now, when they do public opinion surveys, you look at the sample size. I've seen this in Thailand. I stayed in Thailand for quite some time. No? They say the sample size is only 1,200. And yet, it is a survey of the opinion of all Thais. Is that valid methodology? How many will say, yes, it is? Raise your hand. How many will say it's not? Okay. However, you take note that governments rely on public opinion survey. And usually, public opinion surveys will only make use of 1,000 to 2,000 sample size of the general population. It can be valid and reliable. The use of 1,000 to 2,000 as sample size can be valid and reliable if they use random sampling. Random sampling means everyone has a chance to be represented in the population. Everyone has a chance to answer, right? They will look at a database where all of you are there. And in many of this public opinion survey, it's about voters. No? How many voters are there in Thailand? How many millions? 40 million? Huh? 30? 70? That's population, 65. Children do not vote. Voting population. In the Philippines, it's 1/2 because we have a young population. So maybe it's about 30 million. Okay, so you say, how many are voters in Thailand? 30 million. All right. What's the common database that you should use so that everyone will have a chance to be represented? You know what they use? Electoral precincts. I don't know how you call it in Thailand, but this is a list of all the precincts where you vote. Okay? The precincts where you vote, where you cast your vote. Each polling place has a list of voters in that place, correct? Usually, public opinion surveys like this about voting behavior, they will have a list of all the polling precincts. And then they will choose randomly which precinct to go. First step. Second step, so you all belong to a voting place, right? So all of you has a chance to be represented, right? Second step, once they have chosen the polling places where you vote, the voting places, they will choose who to interview. So it's making use of stratified random sampling. So even if the sample size is only 1,000 or 2,000, everyone had a chance to be represented. And therefore, it is valid and it is reliable. That's why, these companies, they earn a lot of money doing these surveys because politicians would like to know what is the voting trend. So that makes use of stratified random sampling, which is a method in quantitative research. There's random sampling that's done. So you must use the proper method. Now, the next challenge, gaining access to a target population and recruitment. Okay? You want to study drug addiction in Thailand. Is there a list of drug addicts in Thailand? None. So where should you go? Maybe you will go to places where they are being treated. Maybe you go to bars where they inject each other, So recruitment is a challenge. My example earlier, if you want to do a study of teenage mothers, you just cannot be knocking at doors and asking, is there a teenage mother in this house? You must go to a place where they congregate, in a hospital, in a primary healthcare facility where they are vaccinated, so that you are able to recruit them. So recruitment becomes a challenge. Data collection and interpretation. Data collection is about the questionnaire that you use, about questions that you ask. So I discuss how to do valid and reliable questionnaires. It's not as simple as writing down a set of questions, but you will have to do certain steps to ensure that your questionnaire is comprehensive enough in order to meet the objectives of your study. Interpretation is another issue. When we go to the provinces in the Philippines, I'm a social scientist, we go to the provinces and then we interview people. Before we leave a particular place, we tell them, these are the things that we gathered during the interview. We are not yet finished with the study. We just finished one province or one town, okay? Then we have a feedback session and we say, these are the things that you told us, particularly if you are using open-ended questions. Did we interpret them correctly? Or did we misrepresent what you told us? We ask them. And usually they will say, this one is correct, this one is not correct, this is not what we mean. So interpretation is not about your interpretation of what they said. Interpretation is finding out what is it that they mean when they give certain answers. That can be a challenge. Relationship between the researcher and the participant can be a challenge. In ethics, we call that the problem of vulnerability. Can you tell your students, okay, I have this study about student nurses. If you answer my questionnaire, I will exempt you from the final exam. Can you do that? Can you do that? No, that's coercion. You are exploiting your power relationship with your students because they cannot say no to you. And then you gave them an additional incentive to be able to answer your questions. All right? So that is not ethical. So how do you gather the questions? Can you use your students? Yes, you can. But you must not be the one directly telling them, I have this study, I will appreciate it very much if you answer my questionnaire. That's coercion. So it's about recruitment. You can post a notice and say, those who want to answer, you just contact this number. But not you directly recruiting them to participate in your study. And usually, they will not give you truthful answers. That's the problem with surveys in many Asian countries. When you ask them a question, they're trying to imagine, what is the answer that this person wants? And then, as a people, we like to please other people, I think that's a very Asian characteristic. So when you ask them a question, they're trying to find out, what is the answer that this person wants me to say? And sometimes you do not commit. You say, maybe yes, maybe no, So how will you record that? Yes or no? You said maybe yes or maybe no, So that is a cultural problem. Unlike, Westerners, they say, I do not like the way you talk. They will tell you directly. But here you say, do you like the way I talk? Or you say, sometimes, but sometimes not, Or I have a party, will you attend my party? Maybe, So you do not want to say no, okay? That is a problem. That's a problem of interpretation. So it can be relationship between the researcher and participant, which may be cultural in nature. That's an ethical challenge. Identifying potential participants for research when research topic is sensitive may be ethically challenging. Okay? So, the question earlier, men having sex with men. You just do not go to the bars and say, I'm doing a study about men having sex with men. Do you want to join? Cannot do that. So I was telling you earlier that in some of the researches I've seen in Thailand, they use the so-called snowball method, where they have they get people in the same community, and these people will recruit participants, and then you train peer interviewers so that they will answer truthfully, not the answers that you want them to write down, not the ideal answers. No? You know, there are many surveys. For example, when there was an epidemic about H1N1, no? What was the intervention for H1N1? That's flu. Wash your hands, right? So in many of the places, you will see these gels. No? So if you do a survey and then you ask them, do you wash your hands before you eat? What will they say? They will say no. They will say yes. Okay? But did they answer you truthfully? No. No? Or for example, you want a survey of whether nurses wash their hands before an operation. What will you do? Ethics committee will say, get consent. So I get consent from the nurses. I say, I'm going to observe whether you wash your hands. Do you allow me to observe you? That will affect the results of your study. So in cases like that, is it mandatory that you get consent? That's an issue, you see? So, ethics committee may waive consent, but what? Will you identify, oh, this nurse, she washed her hands. This nurse did not wash her hand. Do you do that? No. You will just count how many washed their hands and how many did not wash their hands, because there was no consent. Okay? No identifier. No identifier. And you want to observe real-world behavior. If you ask for consent, it will affect their behavior because they will know that they are being observed. So, there are many ramifications, there are many parameters that you would have to consider. Are you just doing actual observation? You know, in social research, we say you do triangulation. What is triangulation? You use 3 methods to validate your data and to ensure your data is reliable. What are the methods of validation? I give you another example. They say that today, one of the biggest reasons for accident is road accident, okay? And therefore, you would like to make a study, what are the road safety measures that drivers should adopt. And one of them is wearing seatbelt, okay? So, first, you do document review, that's literature review. What does the literature say about wearing of seatbelts? That's one source of information. Second source of information, you prepare a questionnaire which will ask the drivers, do you wear seatbelts when you drive? Or, you know, the motorcycle riders, do you wear the helmet, you know, when you use your motorcycle? You ask them, do you wear the helmet? Will they say no? They will say yes. Do you wear seat belts when you drive? They will also say yes. Because usually, the answer we give is the ideal behavior. That's the tendency, okay? But you do not rely on the results of the survey. So you say 95% said they wear seat belts and they wear the helmet. And yet, there are so many road accidents where drivers are found to not wearing seat belts and not wearing helmets, correct? So, you need a third method, no? And what's the method they will do? They will use observation. So usually, in studies about accidents, for example, you're interested in the helmet, you will stand in a corner at a certain time of the day, then you will count how many of those riding motorcycles are wearing helmets and how many are not wearing helmets. Or you will observe how many are wearing seat belts and how many do not wear seat belts, which will give you a more reliable source of information. So asking them the question does not mean that you will get the correct answers and the appropriate answers. But doing observation will help you get the right proportion. And therefore, it's very important that you will make use of the methods so that you are able to get truthful answers. So, you ask the question, will recruitment or identification cause harm? For example, sexual harassment victims. Maybe it is the superior, the boss, who's harassing them. Will they speak truthfully to you about their sexual harassment experience? You will have to consider that. There are many studies like this. One study about domestic violence. You know what's domestic violence? Women who experience violence from their husbands. Okay? Now, where will you recruit? Usually, maybe you should recruit in the hospital where they go for treatment after being physically violated by their husbands, right? And then you are going to interview them. However, can you interview them in their homes? Maybe not. There was a protocol in Africa where they have a radio program, and it is intended for women who experience violence in the hands of their husband. So it's telling them about their rights, it's telling them what to do, and then later on, there's a follow-up interview. If you listen to the radio program, then they will interview them. What do you actually do when your husband, hurts you? Is it physical violence? Is it oral harassment? The words that they speak to you. Can you interview them in their homes? Maybe if the husband finds out, he will hurt the wife some more for telling other people, that he is guilty of violence, you see? So things like this would have to be considered. How do you prevent harm from happening to them? In the Philippines, there was a study about violence against children. I think it was also done in Thailand. The sponsor was UNICEF. And one of the things they want to find out, is whether the parents are the ones hurting the children. But can you interview them in their homes? And, the question of the ethics committee, if they find out, this is the social scientists, if the researchers find out that the children are experiencing violence from their parents, the question they ask the investigator, what do you do? In biomedical research, you talk about serious adverse event. And the obligation is you provide treatment to injury, right? Emergency care. But in cases like this, so we ask them the question, what will you do if you find out that children are being physically violated by their parents? And the requirement was they must refer them to an NGO that takes care of children victims of violence, or refer them to the Ministry of Social Welfare for proper support. In other words, referral to care was required of the group that was doing a study about violence against children. So, that's the measure. So, will it cause harm? And how will you refer? In social science, we call this social harm. In the US, they call this unanticipated problems. but there should be measures to address such unanticipated problem. Disclosure and consent need to be viewed as dynamic rather than static. My example earlier, she does not want to talk about her cancer experience anymore, so she should be allowed to withdraw from the study. Reporting findings should not endanger individuals or communities they belong to. Suppose I want to do a study of sex workers. Do I say that I did this study in Patpong? You need not identify the place, even if everyone knows that happens in Patpong. You have to create an alias for this. So these are some of the challenges. In other words, most of these things are about issues of privacy and confidentiality because you're only asking questions. You are not doing any interventions. You're just asking questions, but the kind of answers may bring some kind of harm if they are identified. So these are the challenges. Now, elements of research ethics. One, you have to look at the social value of the project. Why are you doing a study about violence against children? Because you want to know the incidence, how common is it, and UNICEF would like to adopt measures to prevent violence against children from happening. Many of the social scientists are not interested in normal things. Social scientists are interested in abnormal behavior, abnormal circumstances. I remember I was in one Asian country, and there was a protocol, very simple protocol. It was about a study of teenagers with pimples and how it affects their self-concept. It was a psychological study, okay? Who is the reviewer? The reviewer was a pharmacologist. Pharmacologist says, use 2 arms. She only wants to study teenagers with pimples, okay? Pharmacologist says, use 2 arms. One group of participants without pimples and another group of participants with pimples. Because in pharmacology study, you compare one drug, intervention drug, with control drug. But does it apply? She's not interested in teenagers without pimples. She's only interested in teenagers with pimples. So there's no value adding another arm. She does not need to compare. She knows that teenagers without pimples, it does not affect their self-concept because they have no pimples. So the relationship is between the pimples and the self-concept. And it can only happen in teenagers with pimples, you see? Then the suggestion of the pharmacologist is not appropriate, and that will make the study more expensive and getting useless data. So, scientific soundness, are you able to get the objectives of the study? What scientific methods are you going to use? I give you another example. There was a study in Indonesia about the effect of storytelling to prevent dementia from, among the elderly people in a home for the aged. Her intervention is storytelling. She will talk to the old person. You tell me stories about yourself. She has a questionnaire, okay? And then later on, what is her outcome measure? The outcome measure is she able to perform her daily duties? Can she still cook? Can she still remember things? It's a psychological test, okay? That's the outcome measure. So she will make them tell her stories for 6 months. Then after that, see whether they develop dementia or not. Or if they have dementia, if they are able to remember many things after talking to someone. So the intervention is psychological. Okay. This was reviewed by the Research Ethics Committee of the hospital. The doctor said, will you do an MRI before the storytelling? She said, no. How will you know? You must do an MRI before storytelling and an MRI after storytelling. Oh, you see? The protocol was medicalized. No? The social scientist said, I do not know how to do MRI and I do not know how to interpret MRI results. So ethics committee says, how will you get objective data? No? But in her protocol, she says her outcome measure, she has a tool. No? Ability to do daily household chores, ability to remember, it's a psychological tool that she's going to test whether they have dementia or not. No? So what am I saying? No? The outcome measures are going to be different. You do not need biomedical measures to test whether a social science, a behavioral intervention is effective or not. It has its own measures and its own outcomes. No? And it will require someone who understands those outcome measures to review such kind of research. So, what am I saying? No? Social science research has its own metrics for scientific soundness. No? The thing to check is which is the appropriate method. Should it be qualitative or should it be quantitative? Post-research access. What's post-research access? You share with them the results of your study. You know, in the Philippines, I'm a social scientist. We do a lot of researches in the provinces. No? And one time, we went to one place, and they said, where'd you come from? We said, we come from University of the Philippines. They said, oh, you people from the university, you just gather data from us, and then you disappear. You do not even share the results of your study. No? And they said, previously, there was a group coming from your university. They studied about our pollution problem. We were hopeful that they will be able to tell us what's the cause of our pollution problem because there was a pesticide plant in that town. No? But they never came back to show us the results of the study. No? So, another ethical issue is access to the results of the study. They said, we're not asking money from you. We just want you to share the results with us because that will help us solve our problems so we know what to do. That's access to the information. So sometimes it's about post-trial access, it's about counseling, it is about sharing of information. So these things would constitute post-research access. Qualifications of the research team. Usually we say, if these are undergraduate students, in the University of the Philippines now, they say if they are undergraduate students, the advisor assumes the responsibility for the harm that may result in the study. And therefore, the advice is that undergraduate students should not do very risky research. We get all kinds of proposals in the university. One, she wants to interview a rapist, someone who has raped somebody, because they're very adventurous. Another would like to interview a member of ISIS. And they're undergraduates because they want that sense of adventure. So we tell them, all right, so they ask the advisor, will you accompany these undergraduate students when they interview a rapist or when they interview an ISIS member? And she says, no. Then it is disapproved, So things like that. In other words, it has to match the qualifications of the researcher. And undergraduate students should not do very risky protocols. That's the guideline we have adopted in the university. Protection of research participants. Are they vulnerable? How do you minimize risk? How do you maximize the benefits? How do you protect privacy? And is there appropriate informed consent? Social value refers to the importance of the information that can vary depending on the significance of the health need, the novelty, and expected merits of the approach. No? 3 factors: quality of the information, its relevance, and its contribution. Okay? Now, many times, no, they will copy what? They will copy protocols from the internet. No? And they will do it the same way that it has been done in the US and Europe. One time, I was doing this training, and our case study was a presentation of a paper that won Best Paper Award. But somehow, I doubted whether the student prepared the protocol himself, because it was very good paper. So I asked him, I said, "Has this study been done before?" He said, "Yes, ma'am." I said, "Where?" "In South Korea, ma'am," he said. I said, "How come I do not see any South Korea in the citation?" That's plagiarism. They copied one protocol coming from South Korea. And it was made to appear that this was an original paper. That's scientific misconduct. Plagiarism is scientific misconduct. And therefore, if you copied from South Korea, you say, you cite in your footnote, you say, this was done in South Korea. However, what will make your paper different? One, what is its local objective? You want to know whether this will work in the Philippines or not. You're using a standardized questionnaire that has been used abroad. But what is the value of your paper? Because you will test whether this kind of questionnaire will yield the same results in Thailand. In other words, it becomes comparative. You just cannot copy exactly the original paper that made use of the standardized questionnaire. We refer to that as local value. What is the additional local value for repeating a protocol? Can you repeat a protocol? Yes, with proper citation and with a set of different objectives and a set of different outcomes. Then it can be comparative. That's an issue of scientific soundness. You just cannot copy a protocol, and then pretend that this is yours, this is your original protocol, because that's plagiarism. So I think this is very important in terms of social value. So what is the quality of the information? It is about contribution to local knowledge, its relevance, will this work in Thailand? Its contribution to the creation of good intervention. Then you state that in the objectives of your paper. Then you state that in the outcome measures. Very important, not just copying. That's why in many ethics committees, we say members of ethics committees should be able to do literature review themselves. The function of literature review is not only the function of the investigator. It is also the function of the reviewer. You find out whether this has been done abroad. And it's very easy to do literature review. Now, you just Google, and then all the data will appear before you. Then you are able to say, is this original? What's going to be its local contribution? So these things have now become very important in determining the social value of the research. Post-research access, post-trial availability for communities and population, and very important, dissemination of results of research. You share it with them so that more or less you educate them. Then you tell them, this is what we found out, and these are our recommendations. Then you are maximizing the benefits of the research that you are doing. Issues related to research design. So, is it quantitative, is it qualitative, or is it mixed method? All right. So, you must have the standard sections in a protocol, because many times they just write what they want to write. And I've seen many investigator-initiated protocols that lack the necessary parts. No? So that I think an ethics committee should be able to come up with a standard protocol template. These things must be there. What's the rationale? No? What does literature say about this? What are the objectives? What are the methods? Helsinki will now require ethical issues. No? What's the data analysis plan and what's the outcome? These are very important sections of the protocol that will manifest whether a protocol is scientifically sound or not. And I think that it should be standardized. All right, let's talk about quantitative research. Quantitative research starts from things that we already know about, from general concepts and theories, and then it will do an experiment and come up with the findings of a specific experiment. In other words, from the general to the specific. No? That's the usual approach. No? And therefore, we say it's a linear model. You start with theory. What is your hypothesis? No? In the questionnaire presentation I said earlier, what is your research question? What are your specific objectives? How do you operationalize? You come up with a questionnaire that will measure all your specific objectives. What sampling method are you going to use? What's your data collection plan? You will use a questionnaire. How do you interpret? You will make use of statistical tools to interpret the information. So it's pretty standard, no? And this is what you do in quantitative research. Okay. In quantitative research, the aim is to generate generalizable information or conclusion. If you do a survey of voting behavior in Thailand with 2,000 as sample size, at the end, you will describe general patterns. And you say, these candidates will win in the next election. That's quantitative research. No? You use statistical methods, you check validity and reliability, you state your data analysis plan. Of course, you define how you will gather your data, and it's through randomized sampling. No? You have to use simple or stratified random sampling to ensure that everyone in the population has a chance to be represented. That's mandatory in quantitative research. So, it makes use of quantitative data for precise measurement of social phenomena. Which group of people will vote for the party of Thaksin? Which social class? You can look at that. The demographics will tell you that. Where do they come from? In the Philippines, for every election, they will say the president won in class DE, not in ABC, something like that. No? That's a general conclusion, and they can derive that from analysis of the sample that answered the questionnaire. General patterns are described. Statistics are used to make statements of relationship. Statistical tools can be as simple as percentage and can be as complicated as t-test, and other measures. That's quantitative research. As different from the cyclical model in qualitative research. Okay? So, in quantitative research, you measure each question, and then you use statistics. And therefore, you need a good sample size that represents the population. Sample size is very critical in quantitative research. And therefore, in many ethics committees, I will see biostatisticians who are members of the ethics committee because they are checking if the sample size and the statistical tools for analysis are correct. That is about scientific soundness. Very different from qualitative research. In qualitative research, this is the cyclical model. You start with a temporary hypothesis, And then you do data collection and interpretation with small group circles. Let's say you use these circles as focus group discussion. You do one focus group discussion. You have an open-ended questions. You have an interview guide. And you will write down all the responses to your questions. After the first one, you do another set and you ask the same questions. Are they answering in the same manner or are they giving different answers? As they give different answers, you continue your cyclical model, the same questions, another group. In qualitative research, they say until you reach the saturation point. When do you reach the saturation point? When the answers that you are getting have been said before. You are not getting any new answers and new explanation. And they say that is the point when you stop because you are not getting new answers. So, in qualitative research, can you define the sample size at the very beginning? No. You just say, I will start with 10 and do another 10 until I reach the saturation point. That's one method. However, sometimes they will say, I will only interview 6 and describe what are the answers of the 6 to the questions that I'm asking. That's also allowed. So it depends whether they want to reach the saturation point or not. Why? Because qualitative research would emphasize particular context and setting. Last week our case was about elderly gays in a facility called Golden Gay. So it's just one small facility that took care of old gay people. And I think there were only 20 residents in that facility. And they will interview 6 and ask them about their experience of abuse and neglect. That was the protocol that we reviewed last week. So it makes use of qualitative research. Do they need to reach the saturation point? It's a very small facility. And therefore 6 might be enough. And not all of them would experience abuse and neglect. So it's purposive sampling, it's convenience sampling. But you should state that in your inclusion criteria. So you use methods like ethnography. Ethnography means observation. You observe them. Key informant interview. Capable of providing sufficient detailed account or analysis. So you have to make use of open-ended questions. And you learn how to follow up and you learn how to probe so that you are able to cover all of their ideas, as much ideas that they are able to share with you. Outcome is capable of enabling others to determine the application of the findings to other circumstances. That is the test of reliability. That the methods that you use can be used in other circumstances. That's the test of reliability. The test of validity, is about, are you able to meet the objectives of your study? Are your open-ended questions sufficient to explore the objectives of your study? It may not be generalizable, but you are able to get the answers that you need to meet your research objectives. And your research objectives is not about generalizable information. It's about the last one, in-depth insights about specific situation. So my example earlier, they will interview elderly gays in a facility to explore their experience of abuse and neglect. Then you have to define abuse. You have to define neglect. What are the indicators of abuse? What are the indicators of neglect? No? Abuse may be related to physical violence, emotional violence that they may have experienced from their family. Usually, who objects to a son being gay? The father. No? So you're exploring that. No? The abuse that they experience. Is it physical? Is it emotional? Is it verbal abuse? You should ask questions about verbal abuse, physical abuse, emotional abuse, That's the coverage. So, are you able to explore their experiences related to abuse? Then neglect. What are the experiences about neglect? Economic neglect. Educational neglect, that they are not made to study, they are not made to work. So you have to be able to ask these questions. Now, your findings, the results of your interview with them is not generalizable, but you understand how these people experience neglect and abuse. Then, that makes the objectives match the methods that are being used, and it makes the study valid. In social research, we are not only interested in quantitative methods, we are also interested in qualitative methods. Now, it's about insights, not generalizable information, but I understand what is the experience of abuse of these 6 people. And it may be applicable to other gays, but I cannot draw that conclusion. I just say, among these 6 people, these are their experiences about neglect and abuse. That's sufficient. Now, when you use mixed method, what's an example of mixed method? Disaster research, all right? Many years ago, you experienced tsunami in Thailand or flooding, So, you can do a survey, do random sampling, you have a questionnaire, you ask them about their experiences during the disaster. At the same time, so that's quantitative. And then you use qualitative, you follow up on some of the participants and do in-depth interview with them. That's qualitative. So, in disaster research, you can use mixed method. I stayed in the Ministry of Public Health in Thailand, and our office was near the mental health, and they do a lot of this research. When there is a disaster, they would go to a place, they will conduct surveys, and they will do qualitative research. So they are used to using the mixed method in these types of study. It's capable of generating quality and credible data based on its data collection techniques and analysis plan. What's the analysis plan? I was showing you earlier, you write down all the answers. That's why you cannot have 100 for qualitative research. You only will do 20, 30, 40, 50, I think is big enough. And you will reach the saturation point. You cannot use a big number in qualitative research because you will list down everything they said. You transcribe. I have a transcriber. She will write down. The question is there, and she will write down all the answers. Now, how do I do the analysis? They call it horizontalization. You look at the different groups. What are the common answers that you got? What are the common themes that emerge across the groups? And then you explain that. It has to do with a lot of explanation. And it has to do a lot with describing specific circumstances. So it's quite difficult to analyze. So there's no intention to generalize, and its rigor cannot be based on sample size. Among the national guidelines, US has CFR, there are European guidelines. It's only the Australian national statement that has something to do with qualitative research. I did not see any discussion of qualitative research except in the Australian National Statement. Now, in qualitative research, they will say, we make use of grounded theory, a systematic qualitative research method in the social sciences, emphasizing the generation of theory from data in the process of conducting research. In other words, when I just ask them questions, I have no preconceived ideas on what is the theory that will emerge later on. You know? So it's what you call inductive. From specific answers, then you are able to come up with certain commonalities, themes. No? This contradicts the traditional model of research, where the researcher chooses a theoretical framework and only then applies this as model to the studied phenomenon. There was a PhD dissertation that was reviewed in the University of the Philippines, no? And she says she will use grounded theory. It's about HIV prevention among sex workers. That was her topic. She says, I will use grounded theory. I will use open-ended questions. I will not prepare a questionnaire. I will ask them to answer the questions and generate the common themes that emerge. She said that. So, she said, my first part is exploratory. I will do focus group discussion of sex workers and their practices about HIV prevention. So, ethics committee wants to know the data gathering tool. So we ask her, where is your interview guide for the exploratory part of your study? So she presents the interview guide. She said, I have no questionnaire as of now because I'm doing exploratory study. So she submits that. Then later on, she says, after I finish the exploratory part, I will come up with a survey. So it's a mixed method. No? I will come up with a survey questionnaire that will be administered to a larger group of sex workers about HIV prevention. But right now, I do not have that because I'm only in the exploratory part of the study. So, ethics committee says, okay, we approve your exploratory part. But once you are ready with a questionnaire, you have to go back to the ethics committee and submit your questionnaire. So that's part 2, you know. So, that she said she's using grounded theory, but later on she will do a survey based on the answers she got in the exploratory part. We allowed her to do that, but she had to go back to the ethics committee 2 times because she had no questionnaire yet that she will use among a larger group of sex workers. So that's how it evolves. No? All right. Now, ethical issues. When you analyze social research, one, you have to ask for the project details. What are the project details? Is it about stigmatizing behavior? Is it about illegal behavior? If the topic is sensitive, then you have to determine, can this go to expedited review? Can this go to full board review? What's the level of risk? Then, the type of participants, are they vulnerable? Sex workers are vulnerable. Drug addicts are vulnerable. Women who are victims of domestic violence are vulnerable. So you ask, what protection measures will you use in order to protect them from harm? Risk. Usually, the risk is about the kind of questions that they ask. No? In Thailand, I've seen many HIV prevention protocols. They will ask, how many partners did you have in the last 6 months? Did you use condom when you had sex? Did your partner use condom? This is about private behavior, and therefore that requires informed consent. And you tell them, I'm going to ask you about your sexual behavior in the last year. Informed consent there is very important. No? Confidentiality and handling of data. Do not put names on the questionnaire. Will you allow for oral consent, or do you require a signed consent form? Information and consent form. What do they say? How is data protection implemented? And do you have conflict of interest? This was shared with me by University of Edinburgh School of Social and Political Studies after they attended the FERCAP conference. So, subject selection is an issue. Who will be your research subject? For example, in one private hospital in the Philippines, they say, since this is a risky protocol, you can only do it among the charity patients because it will harm the reputation of the hospital, So we say that's not ethical. What can be done with the charity patients may also be done with the payward patients. So who will answer your question? Relevance of the topic to community concern. Is this a tribal group? It should be respectful of local culture, evidence of support from relevant cultural communities, identify potential negative consequences of the research, agreement with local groups about appropriate recruitment techniques, suitable information. There was one research among a tribal group in the Philippines. They do not want money. What do they want? They said, you give us a buffalo. The research group bought a buffalo for the community, because that was what they wanted. So it's quite different. Their expectations are quite different. Sometimes there can be overuse of certain groups. You should avoid research fatigue. In disaster research, everybody, after tsunami, everybody went to the places where the tsunami happened. Then they're asking the same questions. What happened to you? My husband died. We lost our house. We lost our means of livelihood. We lost our animals. That's investigator number 1. Investigator number 2. You repeat. I lost my husband. Lost our house. Lost our animals. Investigator number 3. You repeat. So that so many investigators, and therefore there is research fatigue. In cases like this, the head of the community can say no more, because they have to go on with their daily lives. Cluster randomized trial. This is usually done in public health research. You have 2 provinces. One province, you do an intervention, and usually it is about health education. Health education on how to protect the environment. Second province is control. You do not do the intervention. You do a pre-test, then the intervention, and a post-test. Then you compare the results of the control and the intervention province. That's cluster randomized trial. That is allowed in public health research. Cultural diversity. Use local language. Develop culturally appropriate ways to communicate the information. I've seen researches like this in the border between Myanmar and Thailand. They want to interview the migrants, and most of them are illegal workers, So how do you make the research respectful, that they do not get found out? And how do you think of ways of making it culturally sensitive to the migrants living in the border of Thailand? That's very important in social research. So usually there's community consultation. I've seen this in HIV studies in Thailand. There is a community advisory board. I'm going to RIHES next week in Chiang Mai, where they do a lot of HIV researches. And in RIHES, there's a member of the community advisory board in the ethics committee. And members of community advisory board can advise the investigator on the proper ways of doing the research in Thailand. So that requires some kind of community consultation. So you need to plan for it, no? You need to consult the community about it. It must be a decision maker who can represent the community. That's very important. Sometimes protocols are very difficult. In Indonesia, there was a protocol about dengue, and the intervention is about the mosquito. They will genetically modify a mosquito so that when it mates with another mosquito, it will kill the dengue virus. Okay? So, what's the method? They will release the mosquito in the household. If you agree, they will release the mosquito in the household. So the problem was informed consent. Who gives informed consent? Okay? The one that gives informed consent is the head, the household head, in whose house the mosquito is released. But the problem is, if the mosquito transfers to your neighbor, and your neighbor did not give consent, so it was a very problematic protocol, and eventually they had to expand the research team. There was a social scientist who had to do community consultation, how to do it properly. There was a public health expert. There was an environment expert to discuss what's the effect of this protocol on the environment, no? Plus the investigator. So it was very difficult protocol, but they were able to do it, within the community. So it requires a lot of patience. So research in communities with limited resources, sponsor and investigator must ensure that the research is responsive to the health needs and priorities of the population. If there's no dengue there, you cannot do this study. So it must meet one of their basic needs. Okay. I just want to talk about how to review social and behavioral research. In social and behavioral research, the panel membership is about scientific and non-scientific members, not about medical and non-medical. In the United States, there are two kinds of panels. One panel is a biomedical panel, and the panel is made up of medical and non-medical people. But in social behavioral research, the panel is made up of scientific and non-scientific members. Who qualifies for a scientific member? In the United States, scientific member has a PhD. But in Asia, we say maybe there are not too many PhDs, but the scientific member should have a postgraduate degree. And I've seen this among protocols of nurses. It is a PhD dissertation of the nurse in the hospital. The reviewer must have a PhD. It cannot be reviewed by the nurse in the hospital, because the nurse in the hospital may only have a bachelor's degree and cannot review a PhD dissertation. So that's the membership. If it's a PhD dissertation, the primary reviewer, or get an independent consultant who has a PhD degree. If it is masteral thesis, someone with a master's degree should review the protocol. So it's about scientific and non-scientific members, and scientific qualification is about your academic degree. That's very important. In Taiwan, the PhD students complain that, the reviewer is not appropriate and do not understand the methods that they are using in their dissertation. And it becomes a problem. So that's very important. Technical primary reviewer with social science research experience to differentiate use of qualitative, quantitative, or mixed method. Non-scientific member with community, NGO, social work experience will be the non-scientific reviewer. All right. In risk determination in social research, we ask this question: is the topic sensitive? This is about HIV prevention among sex workers. Is it sensitive? You say yes. Is the intervention risky? No, it's only a questionnaire. But you are asking difficult questions. The difficult questions, the private questions, will increase the risk. Is the population involved vulnerable? Are sex workers vulnerable? Are sex workers, is it legal in Thailand? Sex work is legal in Thailand? No, you see? So even if it's common, it still is illegal behavior. And therefore, the population is vulnerable. If you answer no to all of them, it can be exempt or it can be expedited. But if you answer yes to 2 of them, it has to go to full board review. So that's the type of algorithm that we suggest related to these types of research. Competencies in social science research. No? Scientific competence to prepare the protocol. You look at the scientific competence of the investigator. Appropriate design, statistical tools for quantitative research, content analysis for qualitative research, community research skills, ethical soundness, subject selection, recruitment and retention, vulnerability assessment, risk-benefit assessment, confidentiality protection, conflict of interest determination, community consultation, and informed consent issues. All of these need to be evaluated in order to come up with a scientifically sound research and an ethically sound research. I think that's my last slide. Okay, are there questions about social science research?
The audience asks if there's PhD project in university submit to our hospital, then we should have PhD reviewer. So, but I think we don't have it, but we can get one
You
for
should get-
alternative member or
Not
special
even
request.
alternative member, independent consultant will do. So if it's a PhD dissertation, you have to invite an independent consultant who has a PhD. Because one of the things that has to be judged is scientific soundness. And just like in the university, if you have no PhD, you cannot teach PhD. So it's the same. No? If you have no PhD, how can you evaluate a PhD dissertation? Sometimes the university complains. They say, oh, the ethics committee does not understand methods. But you have to understand methods as well as ethics. So you need an independent consultant to look at the design and the objectives. No, does not need to know about ethics. And then the ethical issues are discussed at the board.
เข้าใจไหมก็คือถ้าเผื่อเราไม่มีเราก็ไปให้คอนซัลแทนที่เรารู้จักจากมหาลัยมาดูให้ในเรื่อง scientific แต่เรื่อง ethic เราก็ดูได้เองอยู่แล้วโอเคฮะโปรเซสก็ต้องเป็นของ IRB ก็เป็นสตาฟที่เราก็ต้องสับมิทที่เราตรงไปตรงมา
Especially now, there are many difficult social science studies. I have seen protocols about social media. They're exploring social media, online surveys. Very difficult, So you need somebody who's familiar with the methods. Because in social research, they do a lot of things that has not been done before. All these issues about bullying, many things, no? And sometimes you need to understand methods to be able to make judgment on scientific soundness. Ethical soundness, I think the ethics committee can handle, but maybe scientific soundness will require more extensive scientific experience.
I have one question. One audience asked me before, and she said if she have questionnaire, can she use Google form? And then the participant can do Google form, fill the questionnaire and return.
What's a Google form?
It's electronic, some kind of electronic questionnaire. Can you accept it?
It's electronic questionnaire, and then, but who prepared the questionnaire?
Who prepare?
Who prepared?
The investigator.
The investigator, but using Google to what? Disseminate.
Use Google like a tool for their answer the question.
Yeah, I think it can be used, but the issue there is confidentiality of information.
Yes, I think so. But how do you assess? If they use Google, then they go everywhere. Then because
I think the
Google,
questionnaire.
Google company can access their questionnaire.
Right. So that's the problem. You know, in the Philippines, for example, what was the app they use? Scrib. They use Scrib, you know. She was doing a study about schizophrenia. Then she uploaded it in Scrib. You know, the parents got a copy of the data and sued the university, the investigator, and the advisor. So the problem really is how do you, it's like database. I think you were talking about data registry. So what's the governance system? You know? Can Google access it? And will Google be able to identify who answered what? You know, usually, if you will allow Google, one, there should be no identifier. Privacy must be maintained.
I think if you want to do electronic questionnaire, then you must have your own
Database.
IT.
Yes, your
to
own
do,
IT.
To do.
Right, to
You
keep
cannot
it.
use Google form, I think. It's too risky.
Because if they find out, they can sue you. Please take note, health information is private information. Please take note of that. Remember that. Health information is private information. It's not about your voting behavior, but it's about some kind of illness, you know? So, if someone gets access to health information, the investigator is liable.